Hi, my name is Lynn Fitzgibbons. I'm an infectious disease physician, a community member here in Santa Barbara, and I'm here to review a few important community updates regarding COVID-19 in our community this week. This is a particularly important week with regards to COVID, and I want to hit some of the high points. I want to talk about where we truly are with regards to the curve. I want to talk about our transition to purple, look at our case rates compared to other communities, review in some detail the current situation in Santa Barbara County. I want to talk about vaccines, including brand new news coming out today. I want to really reframe, I think, how we're thinking of these coming weeks as perhaps the next chapter, not a new wave, not a third surge, but rather the next chapter of COVID, and then finish up with some important pearls and tips from my perspective as we look to the Thanksgiving week. Let's start first with where we are. Of course, globally, we're at 55 million cases, over 11 million United States cases, and approaching 11,000 cases here in Santa Barbara County. These headlines are somewhat mind-numbing. We see them day over day, and it's very hard, I think, to take these numbers, the magnitude of these numbers, and apply them to our lives. So let's give it a shot. Looking in California, we can see from the beginning of the epidemic until just this week, of course, the first smaller surge, the very large experience we had with COVID over the summer around our state and here in Santa Barbara. And then what we've clearly seen now across our state since the middle of October, which is an ongoing continued upswing in the number of new cases diagnosed in our community per day. If we look at Los Angeles County, and the reason I point out Los Angeles County is if it weren't for county lines, of course, we would just be one big region, the Southern California region. And Los Angeles County is over 10 million of those region's residents. Los Angeles had a very similar experience to the state and to us in Santa Barbara, with the big surge in the summer, excellent success with public health measures, community efforts to bring down that surge through the fall. But now, unfortunately, what we're seeing day over day in Los Angeles County are rising rates. Let's think about Santa Barbara specifically, and let's really jump into the data of what is going on locally. Locally, things are moving a little bit more slowly, but we should, I think, delve more deeply to better understand. In Santa Barbara County, of course, some of our curve was overshadowed back in May by what was happening at the Federal Corrections Complex in Lompoc. We then experienced, as we all remember, the surge through July and August, which of course we felt, as we always do, first in case rates and subsequently in the hospital and in the ICU. Over the fall, we had again, just like the rest of California and Los Angeles, excellent public health success with our numbers coming down, our hospitalizations falling. And in fact, by late October, we had only 9 people across the entire county in the hospital in Santa Barbara County. Unfortunately, in these last few weeks, we have started to see a trend up. I'd like to just pause and give a shout out to an incredible community effort released just in the last 2 weeks, a partnership between the County of Santa Barbara, Legacy Works, and many other strong community partners called sbcdashboard.org. This is an incredibly rich tool that I am thrilled to now have as an infectious disease physician. But no matter what your interest is with regards to this epidemic, I would encourage you to look at this dashboard. I'm going to show a couple of slides from the dashboard. The dashboard is very data heavy, and I would encourage you, if you have 5 minutes, to just click on that first video to orient you as to how to use it. But whether your interest is in case rates, how many events we have around the community, how much food scarcity there has been, the impact on mental health, you'll find data on this dashboard. Even things like influenza. If you're really trying to keep your ear to the ground for when influenza is going to hit our community, there's an entire tab dedicated to influenza. So let's again take a slide from this dashboard and look at Santa Barbara's community cases. This is new cases per day from the middle of October until this week. And what you see here, I want to point out just a subtle difference, is what you see here is the difference in the yellow by new cases based on episode date compared to the jagged green line, which is new cases by the reporting date. Just to clarify, if I went into the testing center on Saturday and had a swab, my collection date, my episode date is that day, is the day that I had my collection sent. If I don't get my results until today, 5 days later, that would be the reporting date. That would be the date that my physician or the testing center reports to the county that they noticed that I was positive. And what does that mean in real time and in practical use? What it means is the state and the local health department very appropriately anchor so much of our policy and our decisions on episode date. It is absolutely the most accurate way to do it. It's most important, really, from a public health perspective, whether whether or not I had this disease on Saturday. That really helps inform decisions. But if we're trying to look ahead, if we're trying to be anticipatory, if we're trying to think what is around the corner, of course, we're going to get our first signal from following episode date. And so here I point out that the changes we're going to talk about that pushed us to purple are based actually on our data, perhaps 7-10 days ago now. And what we're seeing in the green is, even though compared to late October, you can follow the yellow, the episode date data, and you clearly see the trend is upward. What I want everyone to, I think, really notice this week is how much more dramatically the reporting date case numbers have risen. In other words, what we are seeing now with the reporting dates is that we will anticipate that our episode date data, our true data, day over day, is going to probably very markedly increase over this next week or two. And so let's pause and think about what the blueprint for a safer economy is. Remember that back in August, the governor and the state of California, CDPH, the California Department of Public Health, shifted. They no longer kept a watch list of counties that were kind of being carefully monitored, but rather they moved to this blueprint for a safer economy. And this is really the way that they regulated which counties could be more restrictive or more liberal with the reopening of different sectors of the community. There were 3 important metrics that the state followed and continues to follow. They follow these new case rates, the case rates I just showed you. They follow the test positivity of all the tests done in a community, what percentage of them are positive. And they also follow what's called the health equity metric. And this is basically a subset of test positivity, but focused on the most vulnerable quarter of a community, making sure that they're not being left behind. In California, of course, on Monday morning, we had really remarkable news from our state public health officials and our governor that 41 counties in the state of California were now transitioned to purple. And of course, Santa Barbara was pulled quickly to purple. Let's look at our metrics that were announced on Monday. Our case rate, our actual case rate, is telling us how many new cases per day on average per 100,000 residents. Remember, they give us a rate per 100,000 residents because they want to be able to compare our rates with rates of huge counties like Los Angeles or with perhaps tiny rural counties in the northern parts of the state. And so our case rate is 7.7 this week. And again, that data is a look back, and it's a look back, as I'll talk about, to data from over a week ago. They then do a quick adjustment, and this adjustment is really to make sure that counties are doing a lot of testing or doing good testing. And so we get to adjust our case rate down slightly because our county is doing very well with our relative volume of testing. If you do more tests, you get your case rate adjusted down a little bit. If you're not doing close to the state's average number of tests, then your case rate is presumed to perhaps be a bit higher and you get adjusted upwards. Our county on Monday, our test positivity that was announced was 2.7% of all tests being done are positive. And our health equity metric was close at 2.8%. Just to remind everyone, the criteria for moving from purple to red or red to purple or further down the color scheme of the blueprint tiering is based really on a variety of metrics, but probably the most important metric for this week, the most important measure are the case rates. And so again, it was that magic 7.0. If you remember, we were at 7.1 adjusted case rate or 7.7 raw case rate. And that cutoff that transitioned us from red to purple was at 7.0. But let's pause and get context for these case rates. Across California, we are so very fortunate to still be as low as 7.7 with our raw case rates. Our neighbors, Ventura, were at 14 and 17.7 this week. Again, these are unadjusted case rates per 100,000 residents. Los Angeles up to 21. I'll pause there because I think this is probably the most noteworthy change that happened this week. And the state's average is 16.5. Somewhat overshadowing just the granular detail of the blueprint and really enforcing the fact that across our state, we have case rates that far exceed even the purple criteria. For context around the United States, we have New York City at 23 cases, places in Montana, Bozeman, 137, El Paso, Texas, close to 100 cases per 100,000 residents. And of course, the Dakotas being just remarkably hit in these last few weeks, places in North Dakota with 250 cases per 100,000 residents. So what happened officially on Monday? Let's make sure we all understand. Officially on Monday, with this rapid change that the California Department of Public Health and our governor's office were seeing, they said they pulled the emergency brake. And what did that mean? It meant that rather than this 2-week period, the previous rules were you had to qualify for a new tier, a more restrictive tier, and then you had to stay there for 2 consecutive weeks before you would transition. They switched that and they said as soon as you qualify, you switch. They also said that if you have, they also said that they wanted to look only at 4 days instead of 7 days to average. Well, some of this has come under some harsh criticism this week. For me, I think this was actually a very, very wise decision based on the data and based on the numbers. The analogy to me is whether we look at a forest fire and decide whether our home is in jeopardy based on satellite images from 2 weeks ago. If the fire is moving slowly, then that is very helpful. If the fire is moving fast, as I think we can argue it has happened with COVID in this last week or two in California, then there's definitely more urgency and there's, I think, more need to look at really what's happening and to be more nimble and respond more quickly. And so Santa Barbara County officially transitioned, as we all know, to the purple tier on Monday. In California, as I mentioned, 41 counties are now in purple tier, 94% of the state's population. But not to underscore, I think the public health reasoning for this. Of course, here in Santa Barbara, with our numbers slightly better than our neighbors and the rest of the states, I think for many of us, this felt like the rug was pulled out from under us with really a remarkable and very, very rapid change. So what's going on with hospitalizations in Santa Barbara County? I want to pause and make sure everyone remembers that the timing of hospitalizations relative to cases is critically important. With how fast things have changed, we have to remember that hospitalizations always lag, and unfortunately deaths even further. Remember that if there is a transmission event today, if there is a gathering, an exposure at work or school or in someone's household, remember it is going to take 2 to 14 days for the next person who is exposed to even start to develop symptoms. And remember that if they unfortunately are sick enough that they have to go to a hospital, remember it is another 7 days until they are severe enough to need to go into the hospital. And then remember, if they are one of the very, very unlucky ones with this disease who unfortunately die, remember it will be another 1 to 3 weeks until they die. And so what does that mean? If we think about people who are dying from this disease in our community today, if we think about people who are in our hospitals today, we have to think back and remember that the transmission event that led to their hospitalization or their death occurred weeks before, perhaps over a month before. And so let's look at hospitalizations. Knowing it's a lagging indicator, here across the state, we of course saw, and here you see all hospitalized patients in the teal, and in the darker teal, you see ICU level care. And of course, we all know what happened over the summer with a big surge in hospitalizations across our state. And unfortunately, what we are starting to see across the state in these last just 2 weeks is another upswing. In Santa Barbara County, things are moving more slowly. We are, in some ways, a geographic island. It's not impervious, but we are, or impenetrable, excuse me, but it is definitely a more isolated geographic location than much of the rest of the state. And what that means is that this is hitting us more slowly, but to be clear, I think it is absolutely hitting us. As subtle as this looks, and forgive me for the red square, this uptick that you're seeing here is an uptick where we had, back around Halloween, only about 9 people across our county in the hospital with COVID. Today, as I'm giving this talk, we have 19 people. That is a big change in a little over 2 weeks. And the concern, of course, is that if you think of the case rate change that we saw just over the last few days, we know it's going to be another perhaps 2, 3, 4, 5 weeks until we truly feel the effect of even the change that we've seen in the last few days, until we see that effect in the hospital. So what's ahead? COVID vaccines, perhaps the most exciting part of the conversation right now. They have moved incredibly quickly. We have had all of the world's attention, all of the world's experts, and all of the world's money and resources focused on protecting us. A good vaccine would be safe, effective. It would be able to be produced quickly in large scale, easy to distribute and administer efficiently throughout a big population. So what's the news this week? The Pfizer and Moderna vaccines, competing but very similar vaccines, of course, have come out with incredibly exciting news this week. I want to remind everyone, these are a brand new type of vaccine. This is called mRNA vaccines. And what is done with these vaccines is you essentially inject into the person receiving the vaccine a little bit of mRNA. mRNA is like the recipe not for a whole virus, but the recipe for one of the proteins on the virus. And what happens is you inject that recipe into the recipient, and that person's own cells read the recipe, make that protein. They just do what they're supposed to do. They make that protein. They don't make the whole virus. So you can't catch COVID-19 from these mRNA vaccines. But they make the protein. And then what happens is, as that protein circulates around in the body, that person's immune system recognizes it as something that is foreign and mounts an immune response. And what happens is we then have antibodies, we then have memory T cells that are ready to recognize that protein if it ever bumps into a virus with that protein in the future. And so perhaps we vaccinate our emergency room frontline worker as fast as possible, so that come February and March, when those people, that person is working with patients with COVID-19, their immune system recognizes that protein and their immune system is ready to defend against it. The safety data is to come, but what we learned today, of course, is that both vaccines are very equivalent in the range of 94 to 95% effective. And just to be clear, that effective data has only been released about 1 week after the second dose. These are 2-dose vaccines given just a few weeks apart, but this is very encouraging news. We heard this morning that the initial safety data from the Pfizer vaccine is going to be available for review this week, and that they are planning an EUA, that's the emergency use authorization, that would let them use this vaccine on a large scale within days. Extensive planning and distribution and for distribution and administration is underway at every level. So let's talk about this chapter of COVID-19, and I want to pause for a second and explain what I mean. For me, what is going on right now and what is ahead in the next 1 or 2 weeks is apples to oranges from what we went through over the summer. And in fact, what we went through over the summer was similarly different from what we experienced in March and April. So I want to pause and really think about what is different this time around. And it's a lot of good news. It's that we have better access to testing than ever before. It's that we have a younger, healthier population with access to tests. Remember, back in April, when I was contacted by one of my patients who was young and otherwise healthy with symptoms, I didn't have a test to confirm whether or not that person had this disease. And rather, I just simply told them to quarantine and to isolate. Remember, now we have the ability to find this virus, to know who has it, and to get people tested. Unfortunately, with the increase in test availability, we've actually had a much faster increase in test positivity, but make no mistake, more tests has empowered us as a public health society. Through surveillance testing in our most vulnerable populations, we've really developed this thorough, robust way to monitor for this disease. And here I'm very specifically talking about skilled nursing facilities. California's had really very good success, certainly around Santa Barbara County, with excellent what we call surveillance testing. So testing a whole facility, perhaps every week if there's an outbreak, or perhaps every month if things are quiet. And again, this is a way to actively look for this virus popping up before it's too late. This has been a very positive step. And of course, fundamentally, we have improved understanding of the virus and this disease in a way that we simply didn't over the summer and absolutely didn't in March. We know how it's transmitted, and we know how to prevent these transmissions. We know how to care for patients with this, and we know how to decrease mortality as much as we can. I want to pause though and remind everyone some of the data I've already shown you. Despite the fact that with this new chapter, we are better armed than ever before, the magnitude of new cases and rising hospitalizations across the United States and in California is also apples to oranges from what we experienced over the summer or earlier in the year. So what are my pearls? So I just suggest that we all keep in mind this large surge of cases underway across the US and our own region, but also acknowledge that there are many unknowns ahead. We are really yet to see the impact of this recent surge on our local hospitalizations and deaths, but they will come. Travel and gatherings next week will likely worsen case counts, but it will take several weeks to truly see the impact. Please don't forget that as our cases rise this week, it is going to be weeks before we really feel the effect in the community. We do truly have opportunities to, again, flatten our curve. We did it successfully before, and I believe so strongly that we can do it again, particularly in a place like Santa Barbara County. We do need to rethink our travel and gatherings next week. Don't forget the power of good real-time information. I hope that this talk has been helpful, but if it's not this talk, please do find reliable, good information that keeps you up to date on what's going on. And ultimately, these next weeks are going to be critical. They are going to be critical for our personal health, but also the health of our community. And finally, this chapter of COVID-19 will be different. We've reviewed some good ways that it will be different, but please don't forget that the magnitude, the volume of cases that we're seeing across our country, across our region, and now in our own community is really a magnitude that we've not yet seen. So tips for Thanksgiving. Please do, again, empower yourself and your loved ones with good information. Please follow the excellent guidance of our strong public health officials. They've released a set of just really helpful information regarding safe ways to address Thanksgiving and to get through the holidays. I think I can't underscore enough. Please don't be falsely assured by a negative COVID-19 test, either before or after the holiday. Remember back to the slide where we talked about timing. And remember that if I get a test today, that test is simply telling me at this point in time, that test did not find virus in the back of my nose. And remember, that's only, even at that moment, about 80% sensitive. We, of course, have patients who test negative one day, positive the next day. And so what we have to be careful about is assuming that a negative test, and tests are helpful, please do get a test if you're able to get tests. But if you have a negative test, please don't think that that is a license to travel, to take, perhaps, or engage in big gatherings, or do other things that would put the health of yourself or your loved ones in jeopardy. And finally, as I think we all are, please do look for unique, interesting, and different ways to celebrate this year. I can promise you that Thanksgiving 2021 is going to look different. This is a unique year. Let's make it so. I'd like to finish by wishing everyone a safe and healthy Thanksgiving, and thank you very much for your attention. Bye-bye.